If you struggle with back pain from a new or recurring injury or something that comes and goes throughout the years, you've come to the right place. Hi, I'm Stephanie Lovelace, and I'm joined tonight by physical therapist Tina Hines. Throughout this program, you're going to learn the root cause of most back injuries, common limiting beliefs, and strategies to get lasting relief. Living with back pain can have you walking on eggshells. In fact, many people are afraid to move and exercise, fearful that they will throw their back out or re-injure themselves. The interesting thing about low back pain is that it's often very specific. Some people have trouble standing and walking, but feel great sitting and bending. Others can only sit for a short time, but find relief when standing and walking. Then there's this other category that leaves folks needing to constantly change directions in order to get comfortable. Tonight, we'll cover all three, from recent onset to years of back pain. And by the end of the program, you'll learn more about what could be causing your pain, and most importantly, what you can do about it. Please put any questions you have in the comments section, and we'll be sure to cover them during the live Q&A following the program. Joining me here is physical therapist Tina Hines, who's going to take us through the common causes and limiting beliefs surrounding back pain and injuries, as well as strategies to finally get you the relief that you've been looking for. Welcome, Tina.
Hi, everyone. I'm Christina Hines, and I'm a physical therapist. Today, we're going to discuss the three types of low back pain, how each type presents itself, and also some basic exercises to help get you all started. Relief from low back pain is possible for most. And no, you don't always need an MRI or X-ray to get started. There is a great population of people that don't have symptoms that actually show disc degeneration on imaging. Over 50% have disc degeneration, 40% have disc bulging. Over 80% have disc degeneration, and 60% have disc bulging. Over 90% have disc degeneration, and almost 70% have disc bulging. How do these stats really tell us what imaging does, and what role does imaging play if you even have it? Really, the key importance is looking at your symptoms in addition to what the imaging is showing you, and that's really the big key to overcoming your back pain.
Okay, Tina, so can you start us out with an overview of back pain and the importance of understanding it?
Definitely. So I think let's start first with just a basic understanding of the anatomy of the spine, and that will help us understand a couple of the most common conditions that we really see. Great. So I do have a spine model with us. This is a typical spine. So when you're looking at a typical spine from the front, you will see that you have two hemipelvis positioned here, your sacrum or your tailbone. And then we're talking specifically about the low back, so you can see that we have 5 lumbar vertebrae. So L5, 4, 3, 2, and 1 located here. So these are the body of the vertebrae. These help bear weight and support our spine structure and really improve our tolerance to standing and being on our feet. Between our bony vertebrae, we then have our discs. And you can see that our discs are these cushions that really help also provide us support to weight bearing, give us spacing, and that spacing is really key and important in our spine because we have nerve roots. So these nerve roots exit out of these small canals on the sides of the spine, and these nerve roots, particularly in the low back, are really important for supplying the muscles in our legs and also the sensation of skin in our legs. So you'll commonly see a lot of terms that we'll get into, but like sciatica and things are related to a lot of these spinal nerves. When you look at the spine from the back, these are what our spinous processes are, and that's the spot that you can kind of feel when you're poking into the low back. It might be a little bit tender on these surfaces here. So I think just familiarizing yourself with some of the anatomy can help you guys to understand a little bit more about what we're going to talk about today.
Sure, perfect, thank you.
So next we're going to talk about a disc herniation. The important piece of a disc herniation and understanding it is understanding what the importance of that disc is. So when we're talking about the anatomy, our discs are our spacers or our cushions that sit between our bony vertebrae, and that helps support our back when we're doing things such as bending, lifting, or twisting.
Sure. So Tina, when it comes to disc herniation, we often hear the term jelly donut and that analogy. Can you elaborate a little bit on that?
Definitely. So when we think of our discs, imagine a jelly donut, because everything in physical therapy relates to food, or at least that helps people remember it. So imagine the center portion of our disc being that jelly-filled center or fluid-filled center, and the outer portion is a thicker material. It's cartilage, it's more fibrous rings, kind of similar to the outer shell of the donut casing, okay? So when we're doing activities that involve a lot of sitting, bending, or lifting, what happens is that our spine moves forward or flexes forward, and when it does that, it kind of forces that jelly or that fluid to move backwards, as you can see shown here in this model. So that small bulge or red part, almost looking like jelly filling, starts to migrate its way backwards in the spine. And the problem with that is you can see it starts to push on or encroach on that nerve root. And when that disc material moves there, we might start to notice weakness in our leg or symptoms running down into the leg. So that's why people commonly refer to discs working like a jelly donut.
Makes perfect sense, right? So Tina, when it comes to disc herniation, how does the pain typically present?
Yeah, so most individuals that have disc type pathology or pain will typically note that their symptoms are better with activities such as standing and walking, things where you're upright and on your feet. And what that does is it helps distribute the pressure evenly amongst the disc, so you're not putting too much pressure on the forward position of that. On the other hand, you'll typically notice that activities that bother you the most when you have disc-related injury would be sitting, bending, lifting, or twisting. Not to relate back to food, but we call these the BLTs. So that's something that will help you remember that one quite well. But anything really where you're flexing forward, bending forward, putting a lot of pressure on that front portion of the disc will cause that fluid or that jelly to migrate out backwards, and that can increase your pain or symptoms.
Okay, great, good to know. So are there certain exercises that you'd recommend in terms of standing over sitting in this case, or vice versa when it comes to disc herniation?
Definitely. So generally speaking, rule of thumb, any type of exercise that you're doing, you always want to make sure that you're consulting with somebody prior to starting them. But you do want to make sure that the symptoms are not being increased or elevated at any point during your exercise. So always use that as kind of like a check-in or baseline approach to exercise. The first thing that I always recommend with disc type of pathology is doing anything where you're standing or you're upright. So if you're at the gym and you're looking to do cardio, using a treadmill or maybe an elliptical where your body's more upright as opposed to sitting down at a bike would be a great way to maybe get started. Sure. But there's a couple specific exercises that I think you all would benefit for starting with today that I'm going to have Steph be our demo and model for.
So with that in mind, and thinking about disc degeneration in general, what exercises would you recommend in terms of standing over sitting or vice versa?
Yeah, so when you're thinking about disc herniations, you really want to be more mindful of doing any type of exercise or activity that entails your body being in standing. What this does is it really helps distribute the pressure or the forces amongst the disc so that everything's nice and neutral and flat, and that we're not risking increasing or irritating the amount of injury that we currently have going on, like activities bending, lifting, twisting, or sitting. So just being mindful that we're trying to avoid those and do more activities in standing. So with that being said, we're going to show you a couple activities and exercises that can get you started just at a base level if you think that you're experiencing symptoms relative to a disc herniation.
Perfect.
So the first exercise is going to be a standing extension. It's as simple as it sounds. So I'm going to have Steph turn to the side just so you have a better view of what's going on here. In this position, she's going to be shoulder width apart, give her a nice base of support. From here, she's going to lift her arms up tall so they're coming overhead. And from here, she's just going to lean her body weight backwards. In this position, what we're really aiming to do, and then she's going to return to standing, we're going to reduce that disc pressure and disc material similar to that jelly donut analogy. And we're trying to move that disc material right back into the spine and centrally where it belongs. I would aim for Steph to try about 10 repetitions of this activity, obviously monitoring symptom response. You want to make sure that this is not increasing your symptoms or increasing your pain at any point while you're doing this. In general rule of thumb, always make sure that you're consulting with a physician or a professional if you're really not sure where to start.
And how would you recommend, any modifications potentially for people that want to try it but maybe aren't as comfortable in that full extension?
Yeah, so first thing to be mindful of if you have shoulder pain, one of the things that we typically recommend modifying is maybe starting with your hands on hips. So hands on hips would alleviate some of that stress or tension. You'd be doing the same exact motion in standing where you're kind of hinging at the hips, leaning shoulders backwards, and just going within a pain-free range of motion is a really great place to start. If you still can't tolerate standing or being on your feet, another alternative that we usually try or recommend is maybe a cobra stretch where you're laying on your stomach, kind of pressing those chest and shoulders up from the floor. Another really great safe way if you're thinking that you're dealing with a disc herniation of some capacity.
Awesome.
The next exercise we're going to go into today is a strengthener. So this is going to be a lunge with an overhead reach. Same thing, a little bit similar to what we were thinking of before. So what Steph's going to do is face sideways again, because it's going to be a great way for her to be able to show you and demonstrate what's going on here. So she's going to step forward with her right leg. And as she steps forward, she's then going to reach her arms up overhead and lean backwards. So in this position, what we're doing is we're still reducing the disc, but we're allowing her to build some hip and core strength. And then she's going to push back to neutral. Go ahead and step forward again. Again, reducing that disc by maintaining that extended position, strengthening her hips, her core, and her legs to help support that spine in a better capacity. Same thing as before. If you notice that this is increasing your pain or maybe you can't tolerate this, this is something that maybe you're not quite ready for at this stage of healing. So always keep that in mind when you're trialing these exercises. For strengtheners, you also want to be sure that you're not performing them every day. So every other day, about 2 to 3 sets of 10 repetitions is really, really safe and good for this activity.
Perfect.
And we're going to go through one more. So when you're thinking about rowing at the gym, a lot of folks like to use the seated rowing machine. And in that position, unfortunately, you're sitting. So when you're sitting and your knees are bent up, again, that's going to be putting more pressure on that disc and causing that jelly donut to be moving or migrating backwards in the spine. It's going to increase your symptoms and really kind of delay or slow that healing process. So anything that you can do in the gym with cables or weights. So if we imagine that Steph potentially has a cable machine out in front of her, she's going to have her arms straight out in front, and then she's just going to be tightening and squeezing her core as she pulls those elbows in towards her side. So go ahead and do that rowing motion. She's staying tight through the shoulder blades, tight through the core, and a nice standing and neutral posture and position for that spine, which is really key for any type of disc herniation or disc bulging type symptoms. Same thing, since this is a strengthening exercise, you're thinking every other day, 2 to 3 sets of 10 to start. And as always, if you feel that this is increasing your symptoms in any capacity, please stop.
Awesome, thanks Tina. It's a great start to some exercises that are safe and effective for those of you that are dealing with disc herniation or concerned about potentially having that issue in the future. So how about just a quick recap of some key takeaways about this piece of the class?
Certainly. So thinking if you do have back pain and you're thinking you might potentially have a disc herniation or disc bulge, note that your symptoms are probably made better with standing and walking or activities on your feet. Symptoms are likely made worse with activities involving bending, lifting, twisting, and sitting. And that you can use these basic exercises that we just showed you today to help get you started in back pain. And if you feel like these aren't helping, we're always here to address your concerns and consult with you.
So now we're going to talk about the degenerative conditions.
Yeah, so a lot of folks that have degenerative back pain might refer to their back pain as having arthritis. You might hear the terms stenosis, spondylosis, facet arthropathy, degenerative disc disease. As you can see, there's a lot of terms that are kind of snowballed into one type of category. This degenerative category, there's a lot of terms that mean different things. So stenosis typically means narrowing, which is seen in the canals of the spine. So referring back to our spine model, when you're looking at the spine, you can see again that these canals are where our nerve roots exit. So when we're dealing with degenerative conditions, a lot of times as we age, naturally we start to see that our discs shorten and lose their water content. When this happens, our bones come closer together, and you can see that that would result in there being less space available for those nerve roots to exit that canal. We also typically see that our spine curvature will change as we age. Our shoulders tend to round, and what this does is it actually causes our spine position to become a little bit more encroached and enclosed on that nerve. When that happens and that nerve is pinched, again, it may result in symptoms coming into the legs, or you noticing weakness in some of those leg muscles. Really, what you'll start to notice if you're experiencing some type of degenerative condition in nature, similar to what we just described, is that your symptoms are typically made better with activities involving sitting, bending, reaching forward. The reason being is when we don't have space and we tend to bend or reach forward, you can see that as I bend that spine forward, that canal becomes a lot larger and it opens that space, and then that nerve isn't being pinched anymore, and it allows some healing to take place. You might also notice that if you have this type of condition, that your pain is made worse when you're standing or walking. The reason being is when we're standing and walking, our spine is more upright. And as we just talked about, when our spine is upright or maybe extended backwards a little bit, what happens is that canal starts to get pinched on even more. And then that can increase your symptoms and your pain and also deteriorate your function.
Yeah, makes sense. So when we're talking about these degenerative conditions, do they always present with symptoms?
Not always. So there's really interesting research out there when you start looking at asymptomatic populations when they get x-rays or MRIs. A lot of times that you might see underlying, early onset arthritis, or it might be genetic in nature when you've noticed family members that have it. So no, it really doesn't always present with symptoms, which really is the key to being proactive.
Yeah, it can be super alarming, right? Because you just think everything's good and normal, and then all of a sudden you realize you're, offset by this, condition that you never knew you had. So
definitely
very important to stay ahead of it and be proactive with your wellness. So in those instances, what are some treatment options or recommendations typically?
Yeah, so definitely starting with conservative care is always going to be our first plug because we are physical therapists and we can help you. So using exercise are ways to modify your symptoms and also determine your symptom response, and helping build your activity level up so that you're able to move and tolerate more activity. There's a lot of conservative treatments out there that folks try. You can use over-the-counter medications, heat or ice. Obviously, always consulting with a physician prior to seeking these treatments, but massage therapy, chiropractic care, kind of the whole gambit of alternative treatment approaches.
Great. So it's important to remember that safe and effective movement is actually medicine, which brings me to our next question. What are some flexion-based exercises that you think would work well in these situations?
Definitely. So let's start with a couple exercises today that will help you if you feel like you might have a degenerative condition, or you maybe have family genetics that you think you might be predisposed to something like arthritis or stenosis.
So thinking about degenerative conditions, are there certain exercises in this case that you would recommend sitting versus standing, as we discussed with just herniation?
Yeah, so we usually take this approach with a more what we call like a flexion-based approach or a flexion-based exercise. Flexion just simply means bending forward at the spine or opening that canal up. So really thinking about any activity that you do that involves bending forward. If you're lifting something from the ground, or maybe you're standing at the kitchen sink. So we're going to show you a couple exercises today that you can kind of use that flexion-based approach if you think you might have a degenerative type spinal condition, such as arthritis or stenosis. So the first of which that we're going to teach is called a sink stretch. So it sounds just like it is, similar to that first set of exercises, is that if you use a kitchen sink or bathroom sink, whatever you have available to you, what you're going to do is I'm going to just position this on the side so Steph has a nice surface to hold on to. You would ideally like to make sure it's something a touch sturdier than a chair, but for instruction purposes, this is what we're going to use today. So what she's going to do, she's going to position her hands on the chair. Her feet are going to be shoulder width apart. This is always going to give you a nice sturdy base of support and help you feel balanced and centered. From this position, what she's going to do, she's going to sit her hips backwards, keeping her knees straight, and she's going to try to extend her arms a little bit more. So maybe take a step further away. Perfect. Just a little bit more forward. There you go. So the key of this is actually making sure that she hinges at the hips. So what I see that if patients have their feet too far away, what happens is that when you come back up to standing, your back starts to arch, and that might make your pain worse. As we talked about, standing and walking or things involving backward bending are not going to be good for this type of condition. So if you're trialing this exercise, your feet really have to be stacked right under your shoulders and making sure your hips are sitting back, knees are staying nice and straight. It also might give you a nice hamstring stretch. This is something that would be safe for you to try a couple sets of 10, multiple times a day or at symptom onset, because it's nice and gentle, it's a stretch, it's meant for pressure relief. So really great. Easy way for you to get started. Next exercise that we're going to go into is a deadlift. So I think a lot of folks complain with like lifting, maybe picking things up off the floor, playing with their grandchildren, things that are really important for really maintaining good longevity and spine health. So an RDL, or a Romanian deadlift, or just a standard deadlift, really forces us to use our core muscles and our hip muscles. And when we engage these structures, we really help support the spine better by creating muscular control so that we're not putting too much pressure onto those bony surfaces that maybe don't have that disc to support them anymore. So for just a visual purpose, I'm going to also have Steph face the side So really similar to the sink stretch actually, except for this piece in a deadlift, you do not have the support. And what that is going to force you to do is use your muscles. So what Steph is going to do here is that she's going to softly start to sit her hips back towards me. She's keeping her knees a little soft as she's reaching down towards the floor, and then she's going to return back up to standing. So as you notice she's doing really well is that her hips are coming back. She's not just bending and rounding forward at her spine. That puts a lot of pressure on your spine. So you have to be careful if you're bending or trying to lift something up. So using your hips, using those bigger muscles and bigger movers to really help keep your spine engaged and prevent risk of injury. So that was the deadlift. This is a strengthening exercise. So unrelated to the previous one, again, you want to make sure that you're not doing something like this daily. Maybe 2 sets of 10 every other day, about 3 times a week would be great on this. If you felt like this was maybe too easy, you could always trial adding some weight with this activity as well.
Sure. And would a modified version of the deadlift essentially be like the sink stretch?
Really similar to the sink stretch. You might, even with the sink stretch, maybe want to bend your knees where you're working into some capacity of like a squat where we're really engaging the glutes or the hips a little bit more. So that would be a great safe way with support that you could start to strengthen and build some of the muscles around the spine. Okay. And we're going to show one more today, and this is going to be a lunge with a reach to the knee. So again, to that flexion-based approach, anytime that you're flexing or bending that spine forward, we're opening those canals and we're preventing compression from the bones on each other and also the bones on those nerve roots. Yeah. So we're going to start with a sideways lunge because what this does is it actually forces us to engage our outer hips more and also our obliques. So you're going to start with your feet together for this one. I'm going to ask Steph to step out to her right side, and when she does that, she's bending her knee and reaching down to the knee. You can see that as her shoulders drop forward, that is actually causing what we call a flexion-based approach. She's then going to push back up to standing, and I'm going to have her demo this from the side as well, just so you can get an idea of what her spine is doing. So go ahead and face the side. So she's going to step out to her side, her reaching to the knee, and I want her shoulders to come forward where she's coming down and then pushing back together. Next time, Steph, I want you to keep your feet so both toes are facing forward and your feet are in a straight line with each other. So watch this one more time. Step out to your right, toes facing forward, and she's flexing that trunk. Perfect. So this is keeping her canals nice and open, and then she's going to return to neutral. This is a great way to start, nice and safe for any type of degenerative condition, keeping that spine open and starting to build those muscles to support your spine as well.
Awesome. So would you recommend these 3 exercises as safe for any age or fitness level?
Definitely safe for any age or fitness level related to this condition. If you feel like these are too challenging, you can always change them to make them less challenging by moving through smaller ranges of motion or by holding onto something for support. So if you feel like these are really just too much, you're not sure where to start or maybe bridge that gap, obviously we're here to consult with you or you can always contact your physician as well.
And also just considering if you want to give it a shot and are feeling overwhelmed by doing too many at a time, just less reps and work your way up, from 5 reps to 10 to 15,
exactly.
Go take it a little at a time. Better safe than sorry.
Exactly.
So how about just some key takeaways for this piece in general? Obviously best to be proactive and to get ahead of it, knowing that sometimes these conditions can be asymptomatic.
Definitely. So I think just summarizing again, those degenerative conditions, typically people present with their pain being made worse with activities on your feet. So your pain is made worse with standing and walking, and you feel that your pain is alleviated or made better with activities involving sitting or maybe reaching or bending forward. Again, proactive in being on top of your symptoms and managing your health and wellness is really key to maintaining a healthy spine as we age.
So now we're going to talk a little bit about weakness and instability. I know previously throughout the program, we talked about the importance of moving when dealing with back pain, but is there ever such thing as too much movement?
Yeah, for this category, unfortunately, yes. So oftentimes with instability, the low back is seen as a compensator. So what we see is that the things around the back are not doing their job. And what I mean by that is maybe our upper back or our thoracic spine and our hips might be too tight. What that does is it causes excessive wear and tear, and it accelerates degeneration on the spine. In addition to that, we also see that core weakness can really accelerate or deteriorate the spine relative to instability. The reason being is because our core muscles or abdominal muscles actually insert and attach on the spine. So the stronger they are, the more support they provide it, and the better success we have with performing any type of functional activity.
Sure. So obviously balance and weakness affects multiple parts of the body and different areas that we would probably need to focus on to build up that strength. So what are some of those areas that you would recommend focusing on for exercise?
Yeah, so really our core consists of anything like our trunk and our torso. So think about your abdominal muscles, your obliques, even your back or your spinal stabilizers. Anything also including your hips. So this is something that I think people often miss when they're doing strengthening exercises for the core. This section is great. Your midsection it does a lot of things relative to supporting your spine, but our hips and our core are really our entire base of support. So when you think about anytime you're standing and you're on your feet, if these muscles are weak, what you're doing is just relaying all that stress upward into the spine, and you're setting yourself up for failure. So thinking about your glute muscles, your outer hips, your glute max, your quadriceps, your hamstrings, all of those muscles really are part of our core, and they consist to help us provide stability, especially with the conditions such as instability.
Awesome. So why don't you take us through a few of those exercises that folks watching can do at home or from anywhere for that matter, whether they're short on time or just trying to fit in some extra stretching and strength building throughout their given day.
Definitely. So today we're primarily going to focus on strengthening of the core and the hip muscles because of the instability resulting mostly from a weakness perspective here. So the first exercise that we're going to start with today is a bridge. It's exactly kind of as we sound for all of our exercises, easy and really functional for you all. So I'm going to have Steph come down on the mat for me. And she's going to start by laying on her back with her knees propped up. So in this position, her feet are about shoulder width apart, similar to previous exercises. Her hands are down at her side and she's nice and relaxed. What she's going to do prior to lifting her hips is that she's going to tuck and engage her belly. So she's trying to pull her belly button down in towards her spine. She's tightening her core. From this position, what she's going to do is she's going to drive her weight through her heels of her feet as she lifts her hips up towards the ceiling. She's getting a nice neutral tabletop position. You should see from your knee to your hip to your shoulder, you're seeing in a nice straight line, and then she's slowly releasing. The biggest mistake that I always see with a bridge is that people are arching and just driving up through the weight of the back of their spine. From there, you're actually not engaging the core in any capacity, and you're just putting all that stress right onto your back, which we're trying to take off of it. So really the key to this is performing that little tuck where you're squeezing and engaging the abdominals first, and then you're initiating the lift. Because this is a strengthening exercise, you wanna be sure that you're only performing this every other day, and try 2 to 3 sets of 10, kind of easing into this. If you notice that you're having difficulty getting down on the floor potentially, you can always perform this on a bed or a couch or a surface that will enable you to get up safely and easily.
It's also important to keep breathing.
Breathing is always important. All right, we're gonna stand up. Next here, what we're gonna go to is a squat. So for a squat, everybody loves them and everybody hates them at the same time. So they're a really essential, integral part of our daily activities, thinking about getting in and out of chairs, standing up off of toilets. You might not have something to hold on to, and it's really important to keep our core and our hips engaged, again, because all these muscles are really important in providing that support to the spine and preventing it from compensating. So for a squat, what you're going to do is start with your feet shoulder width apart. Steph's going to sit her hips down and back, kind of shifting the weight through her heels, and she's adding a forward reach, and that's totally fine. So the key with squatting is that there's so many variations and types of squats that you can do, and it really is what works best for you, especially when you're first thinking about starting an activity. So for this, I'm just gonna cue a little bit more of a weight shift back through her heels, so I want her hips hinging down and back, and you notice that prevents her knees from going forward over her toes. This will really save your knees if you're maybe dealing with any type of arthritis or some aches and pains associated with that as well. And a lot of folks will always say, you know, I haven't squatted in years, there's no way. There's so many modifications to a squat. So you can start by holding on to the counter or a kitchen sink. You can maybe start by having a chair position behind you and building that surface up, maybe thinking about adding a couple pillows or a phone book if people even have those anymore. But just something to kind of take some of that stress away from the lower body and really, again, focusing on keeping your core tight, using those hips and legs to lower your body, and that kind of sets you up for success. If you're feeling like a squat is potentially too easy, kind of referring back to what we talked about earlier was the deadlift. So, you know, you might still notice trouble or difficulty lifting things off of the ground, and you can always kind of go right into that deadlift progression where you're working more on that hip hinge, keeping that core nice and tight, adding weight, repetitions, all of that fun stuff will kind of set you up for success, especially when we're thinking about strengthening.
Yeah. And the great thing about all of these exercises is like I said, you can do them from anywhere, anytime, in the comfort of your home, and with all kinds of modifications to make sure you're comfortable and safe, which is obviously the most important. So just let's take a quick recap at what causes a weak back and what happens if that's left untreated.
Yeah, so again, a weak spine is not just referring to changes relative to bony health. We're typically saying the things around the spine are weak. So referring to our muscle, our core strength, our hip strength, our obliques, all the supporting and surrounding structures to our spine can really cause things to be unstable or weak as we age. Really, if something like this does go untreated, what we start to notice is maybe progressing more into that degenerative type category that we referred to earlier. So again, if our spine starts to move too much and we don't have those supporting structures around it, what happens is that those bones might start to rub on each other, it might accelerate that wear and tear, and in turn, we start to lose some of the disc spacing, we might start to notice symptoms coming into our legs. So it's kind of like a snowball effect. So really important, again, proactive and staying moving is really the key.
Awesome. Thanks. Thanks so much, Tina. What would you say is the one key takeaway from today's class?
I think when you're understanding back pain, really the key is determining the right set of exercises based on your symptoms, and then using the exercises that we taught you today to help get you started.
Perfect. So in addition to the great guidance that Tina provided, the important thing to remember is that everyone experiences normal wear and tear on their body, and that the back is a particular area of vulnerability for accelerated wear and tear. For anyone struggling with back pain, we're here to help show you that it's safe to move and exercise. You just need the right plan in place. Next up, we have our live Q&A with Tina, so be sure to drop your questions in the comment section, and we'll be right back to answer those for you. Thanks, everyone. And we're back for our live Q&A with Tina. So let's take some questions from our audience. To start, what's a good exercise for L4 or L5?
Yeah, so when we're thinking about the spine and talking about just an anatomy overview, I'm going to grab the spine model just for a little bit of overview on that. So when you look at the bottom or like the tailbone region, thanks, Steph, coming right up from our sacrum is our L5 vertebrae, and then right above that is L4. So depending on what we're talking about relative to L4, L5 injury, we could be dealing with a fracture of some capacity, a fusion, a disc herniation at that level, or maybe even arthritis. So typically when we have symptoms or injury pathology associated with that L4, L5 region, again, using some of the guides from that we talked about earlier in the class. Are you feeling better with sitting? Are you feeling better with standing? Depending on what is guiding those symptoms is really going to hone in on where you should start with treatment. However, if you're noticing that L4 or L5 is the area that you're having injury pathology with, especially relative to disc pathology or arthritis, you might be noticing that symptoms are coming down into the legs. So just kind of keep an eye on those. And as always, if you're looking for some more specific feedback, we can kind of address that later on in the Q&A here.
Always good to listen to your body and know, what feels good and what might not feel so good. Okay, the next question, what about a curved spine that looks like a C? Recent bone density tests revealed this, and from sitting so much over my life, not wanting to do surgery, but just get it as straight as I can, will core strengthening help?
Yeah, so when we age, there are natural progressions that start to occur in the spine, and there can be C-shaped curves or S-shaped curves. And you might hear these referred to as like scoliosis or excessive like anterolisthesis. You'll sometimes see on imaging reports. These are really large words. But generally speaking, when we're thinking of curves, yeah, this does happen naturally if we have excessive amounts of sitting or standing, things that change our posture and the way that gravity really influences our spine. And when that curvature starts to happen, really by maintaining good flexibility in the joints around our spine, like our hips and our upper back, and also good core strength can really help either prevent that curve from progressing or help revert it to some extent. So great question.
Is there any help for herniated discs or a posterior tear, or should I refrain from exercising altogether? Terrible pain each day.
Yeah, so kind of touching back on the disc portion of this course and class, discs typically respond better to activities where your body is upright, so anything involving standing or walking, and generally speaking, anything that's pain-free. When you have disc herniations, especially that are large, resulting in that posterior annular tear on the disc itself, you want to really refrain from anything involving bending, heavy lifting, anything that's increasing symptoms into the low back or into the legs. Make sure that you're being safe with those for sure.
Great. Is extension contraindication for those with stenosis?
Yeah, so I wouldn't say it's a contraindication, but those with stenosis or any type of arthritis or degenerative changes will definitely respond better to flexion. So thinking back to like that sink stretch or anything where the trunk or spine is moving forward because you're gapping or opening those spaces in the spine. I wouldn't say it's contraindicated again, but be mindful of what you're doing relative to extending or leaning backwards, thinking about like cobra stretches or something like an upward dog of those capacities. If it's reproducing your symptoms, definitely you should be avoiding whatever that activity is.
Awesome. I have hip bursitis. Is this from lower back pain? I also do bridges every day. Is that hurting me more?
Yeah, so hip bursitis, it's kind of like what came first, the chicken or the egg. You might have had bursitis and then you compensated as a result of that and it increased your low back pain, or you might have had some underlying stressors or issues in your lower back that then contributed to the hip bursitis. So kind of honing in on what the cause behind that is can be helpful. Generally speaking, bridges for bursitis are going to be really safe because they keep the hip in a relatively neutral position. Again, if it's reproducing your symptoms, I would be mindful or cautious of how you're doing them, but globally speaking, it should be a really safe exercise for you.
Awesome. What do you recommend for someone who's had fusion surgery?
Yeah, so depending on when you had the fusion, every surgeon has their own set of post-operative, rehabilitation protocols and guidelines. So really being mindful of what they're looking for, ask a lot of questions at your follow-up, and ask if they can give you those post-op precautions. We typically do receive a copy of those. You can also ask your physical therapist as well if there's anything that's unclear or you're maybe unsure of. So usually heavy lifting and twisting are the two big no-nos I would definitely stay away from, at least early on in those first 12 weeks or so. And keeping the spine relatively neutral while that instrumentation heals into the bone. So thinking about just light core work, light hip work, light stretching in the muscles around the back, but keeping the back kind of neutral, similar to that instability type category.
Super helpful, thank you. If you can do a sink stretch easily, can you just do a downward dog?
Yeah, great question. So a downward dog is essentially the same capacity of movement at the spine as a sink stretch, but there's a little bit more load because you're working up against gravity in that position. So as long as it's not increasing pain, great way to stretch the spine and the lower glutes, hamstrings, everything along the back of the chain of the leg. So as long as it's not increasing any symptoms, go ahead with that downward dog.
Great. And any additional exercises for disc issues?
Yeah, there's plenty. It's kind of hard to delve right into the specifics of that, but think about anything that you do at the gym relative to strengthening the legs or strengthening the core, and then incorporating that into some capacity of standing. So you can always add resistance, thinking about how we were talking about maybe that standing tubing row. You could add cables. You could do maybe standing marches, something where your spine is nice and upright. Again, just avoiding any type of squatting or anything where you're lifting heavy things from the ground, like a deadlift would definitely be something early on you'd want to avoid. But just start with lightweight. You can always add sets, repetitions, things, and kind of build the strength up from there.
Awesome. Yep. You can always modify either to enhance the stretch or maybe dial it back a little bit if you're feeling a little bit of that discomfort. What about cortisone shots to L4 and L5? Can that help to alleviate tightness or numbness in the thighs above the knees?
Yeah, so cortisone injections are not something that we do ourselves, but we work with a lot of orthopedic surgeons and neurosurgeons that do perform them. Cortisone injections are really just meant to help with the inflammation in the area. So think when you're taking an anti-inflammatory, maybe over the counter, that's oral, so it's more systemic, it's affecting the whole body. When we're thinking about an injection, it's going right into that spot where we're potentially having issues arise from. So it can be a little bit more direct in helping take down the inflammation or irritation in the area, which then can alleviate potentially some of the numbness and tingling into the legs or some of the pain. However, it's not going to address the underlying causes what is creating the numbness or tingling. So there won't be any healing to those structures, but again, it can buy us some time to take pressure off things, get it more comfortable so that we can build up the movement tolerance, kind of work on some flexibility and strength before that wears off.
Great. The next one is, do spine issues discussed today cause tight IT bands, and what exercises help?
Yeah, so really any spine issue can result in pathology in other joints, because as we start to experience tightness or pain in the area, our body naturally is going to want to compensate, which is a good thing because we have other movers that can kick in and help, but long term that wear and tear can accelerate. So the IT band is a dense connective tissue, so it's not a muscle itself, but it spans essentially from the top of your hip or pelvis all the way down past your knee joint. A lot of times our runners have issues with an IT band, so like foam rolling is something that you could potentially try, again, to tolerance, because that will help that band release a little bit, and just general lower extremity stretching, so stretching our quads, stretching our hamstrings, things to try to take pressure off that outer hip region. Typically, if you're having an issue with this, making sure that it's not arising from somewhere else. So sometimes people mistake that IT band pain. It might actually be nerve symptoms coming from the spine. So if you're unsure as to what is causing that, or maybe what your issue is, always consult with somebody first.
Yeah, definitely. Better safe than sorry. I have scoliosis. Will these exercises provide comfort and strengthening, but will I always be crooked? So it's helping, but they're kind of just looking for some clarification.
Yeah, it really depends on the degree of your curvature with your scoliosis and how long you've had it for. To some extent, we likely won't be able to revert every degree of the curvature in the spine as we age. Unfortunately, there's some limitation in that, but the stretches can prevent it from worsening over time. So these will help take pressure off your back and make things more comfortable in your day-to-day, and we certainly don't want those curvatures progressing. So thinking of ways to keep your upper back mobile, keep your hips mobile to help support your spine in a better capacity, and then the more we can build up the core strength, that's where we get our endurance to be able to stand or reach or lift or push or pull for longer periods of time.
Awesome, great question. And is it safe to exercise when pain is present?
Good question. We get this a lot. So it really depends on your capacity of pain and kind of what your threshold is. So we like to use a Goldilocks principle a lot. So if you're maybe somebody that has had chronic pain, you've lived with pain for a long period of time, you might wake up and every day you have a baseline of a 4 out of 10. And that's just kind of your natural, normal day, and you just kind of go on and live with it. If you're exercising and your pain is staying at a 4 out of 10, it's probably good to be doing whatever it is that you're doing, because we do need to build that threshold and tolerance to some capacity. If you're starting at a 4 out of 10 and your pain is going up, 6, 7, 8 out of 10, that's usually when we recommend, okay, you're probably doing something that's creating some type of irritation or inflammation into the area. So let's figure out maybe a way that we can modify it or taper things back, scale things back to really help you move into that more comfortably. It's not that you can never do those activities again, but building up a program to address those with your specific impairments can sometimes be a little bit more helpful. So it's a little different depending on the patient. It's specific to your case.
Great, awesome. And lastly, if viewers are looking for more guidance or one-on-one attention, what do you recommend?
Yeah, great question, Steph. So we're actually going to be offering free low back screens at our Sheridan and Worley locations through April 7th. So this will be an opportunity for you to have a brief one-on-one consultation with one of our therapists, kind of talk about maybe potentially some problems that you've been dealing with, and maybe just a way to get started or some guidance relative to that, or if it's maybe more appropriate for you to start a plan of care, we can kind of talk to you what the logistics would be behind getting you in for a physical therapy treatment.
Okay, awesome. All right, thanks so much, Tina, for all of your insights, and to all of our viewers for joining us tonight. If you haven't already, go ahead and sign up for our Find Your Balance class. That'll be on April 18th at 7 p.m., and we look forward to seeing you then.